how to improve testosterone level in a younger male. So, welcome back. This is Angelic Wellness, and I want to talk today about testosterone replacement or treatment in young men. So, as you know, there was a video that I released earlier in the series that talked about how a lot of patients that were exposed to COVID infection, for example, had significant loss of testosterone level. And a lot of these patients did not fully recover after the infection was over. For months and months after, now we're talking years after the infection, a lot of these patients still have some degree of testosterone deficiency. And we've been talking about in my clinic about how to help the males that were younger, where we didn't necessarily want to start giving them testosterone replacement yet, because we're like, they got a whole long years ahead of them. So we didn't want to start replacing their testosterone at this young age. I'm talking about my patients in their mid-30s, early to, even I've seen some in their late 20s as well, 40s and so on, that do not want to go on testosterone replacement yet, because they know that testosterone replacement, when you're putting in exogenous testosterone from the outside, it can have its effect on how your testes function over time, right? Because by giving yourself testosterone, there is what we call testicular shrinkage, which makes it smaller over time, right? We want to preserve that volume for as long as we can, especially in our males still at that reproductive age. They still want to have kids, they still want to make enough sperm. We don't want to start giving medications that will slow that down or diminish that effect. So, for this reason, we have to look at alternative treatments and things that we can do to help these patients get better. So, one of the commonly prescribed off-label, treatment for testosterone in young men is this medication called Clomid, or the generic will be called Clomiphene, So Clomiphene works by actually stimulating your own body to make its own testosterone. And this sounds really, really nice for my patients that are like, oh yeah, I don't want to inject anything that's not made in my own body. I want my own body to make it. So it sounds great. It is a great option for these patients if it works. So Clomid or Clomiphene is a pill that you would take every day, and ranges from 25 to 50 milligrams, somewhere in there. And it has to be prescribed by a doctor, and you would take it daily. And after usually we give it about 3 months, we check your testosterone level to see where it increased from baseline to 3 months on treatment. And what we are seeing is, yes, a lot of men do improve their testosterone function, their testosterone production by taking Clomiphene. And it is something that you can be used short-term or long-term. But I usually say that if your testosterone level is low because of something like COVID, that was an infection that actually caused it to drop, well, by stimulating it with Clomiphene for a short amount of time should hopefully help you recover. And one of the things that we see is once testosterone level recovers, it tends to actually stimulate this feedback in the brain that kind of gets things going again, right? It helps to burn the belly fat that might also be disrupting the function of the testes, and we start to see some additional benefit from that. So we recommend sometimes for some patients, once we weigh the risk and the benefit, to use Clomiphene. And once we use it, we follow the lab levels, and then we are able to know when to wean the patient off. So one of the things to consider is, what are the side effects that we are actually weighing? We do know that if we keep patients on Clomiphene for a long time, for years and years and years and years and years, we can sometimes find prostate problems, So for that reason, long-term use, we gotta really weigh it. Vision problems has also been mentioned as a potential side effect, and some patients will report headaches, a little bit of fatigue, and maybe mood swings. those are things that we're looking at if we're wondering if the clomiphene is starting to cause problems. But again, in my practice, it's something that I will use short term to help patients kind of just recover from when we know that this is something that was temporary. It is not like a problem where there's a tumor in the brain that's not letting them release the testes and so on and so forth. So we have done a bunch of tests looking at prolactin level, looking at the FSH, the LH, the luteinizing hormone, to make sure that there's no other causes of this low testosterone, and then we can then just use clomiphene for a short time to stimulate and get that better. In addition to the clomiphene, all my patients know we definitely want to be doing the lifestyle changes. Okay, what do I mean by that? Well, we want to be improving our diet, not eating red meat that's been fed with too much hormones. We want to make sure we're not drinking out of plastic bottles, right? Introducing that BP, into our body. We want to make sure we are, hydrating properly. We're taking the right supplements, right? So we talk about things like taking zinc along with a multivitamin, along with, taking, B vitamins and vitamin D, all these things that help the body make its own hormones and balance everything. So they're making all these changes along with taking this medicine, not just, taking the pill and not doing anything else. So again, this is one of those off-label options, prescription-wise, that we can use to help men bring their testosterone level up, especially in young men that are still planning to have babies and don't want any type of testicular shrinkage that we then worry about in terms of fertility. Hope that has been helpful. Ask any questions you have about this drug or this topic in the section below. I would love to read your comments, and if you've used Clomid and it was helpful or not helpful, I would love to hear your feedback as well. So leave it in the comment section below, and don't forget to subscribe so we can catch you on the next one. All right, talk to you then. Bye.